right, so welcome everyone to the February 7th, 2022 Grafton Board of Health meeting. As a preliminary matter, this is Karen Gwozdowski-Gobin, Chair of the Grafton Board of Health. Permit me to confirm that all members and persons anticipated on the agenda are present and can hear me. Members, when I call your name, please respond in the affirmative. Dan Finn.
Dan Finn here.
Austin Magnet.
Austin Magnet is present.
Bill Muller.
Bill Muller here.
Jennifer Maynard.
Jen Maynard here.
All right, and then staff and anticipated speakers on the agenda. When I call your name, please respond in the affirmative. Nancy, I think, was not feeling super hot, so I don't think she was planning on attending, at least not on camera. Then Colleen Bolin.
Hi, everybody.
DJ Wilson. I don't see him yet. And then Sherry Tangri.
Here.
And that was all I had for anticipated people. I would like to open the meeting. Can I get a motion to open the meeting?
This is Dan Finn, Vice Chair. I'd like to make a motion to open this meeting.
Is there a second?
This is Austin Magnet. I will second that motion to open the meeting.
All right, and then roll call vote.
Dan Finn, aye.
Austin Magnet, aye.
Bill Muller, aye.
Jen Maynard, aye.
Karen Gwozdowski-Gobin, aye. So the meeting is open. Good evening again, everyone. This open meeting of the Grafton Board of Health is being conducted remotely, consistent with the Act extending certain criteria for COVID-19 measures adopted during the state of emergency in Massachusetts. This act includes an extension until April 1st of 2022 currently of the remote hearing provisions of the March 12th, 2020 executive order suspending certain provisions of the open meeting law. In order to mitigate the transmission of the COVID-19 virus, the act extends the requirement of the open meeting law to have all meetings in a publicly accessible physical location. Further, all members of public bodies are allowed to participate remotely. The order, which you can find on the town's website at www.graftonmass.gov, allows public bodies to meet entirely remotely so long as reasonable public access is afforded so that the public can follow along with the deliberations of the meeting. Ensuring public access does not ensure public participation unless such participation is required by law. The only topic on tonight's agenda that has public comment is the public hearing that'll be coming up at 6:45 regarding the potential tobacco sales regulation updates. None of the other topics on the agenda have public comment period. Let's see. For this meeting, the Grafton Board of Health is convening by video conference via Zoom as posted on the town's website, identifying how the public may join. Please note that this meeting is being recorded and that some attendees are participating by video conference. Accordingly, please be aware that other folks may be able to see you and that you take care not to screen share your computer because, as we all know by now, anything that you broadcast could be captured by the recording. Any supporting materials that have been provided to the members of this body are available on the town's website, or for example, with the draft tobacco updates, there was, as part of the legal notice, a way to obtain copies of those if any parties were interested. The public is encouraged to follow along using the posted agenda unless I note otherwise. Before we turn to the first item on the agenda, just allow me to cover some basic ground rules for effective and clear conduct of our business and to ensure accurate meeting minutes. For any topics on the agenda, I'll introduce any speakers. And then I'll invite any board members to provide any comments, questions, and/or motions. As always, please identify yourself by your name when speaking. Please remember to mute your phone or computer when you're not speaking, and then please remember to speak clearly and in a way that helps generate accurate minutes. For any response, please wait till I, the chair, yield the floor to you and state your name before speaking. And then finally, any votes that are taken on any motions made during this evening's meeting will be conducted by a roll call vote. So with that, let's turn to the first topic on the agenda, which is the Alliance update. Colleen?
Hi, everybody. I'll start off by sharing, and you may not have seen it yet. It came out this afternoon, but Matt Moore, who's our new communications specialist, revamped our monthly Board of Health update into more of a newsletter format, and is much more informative on not just some of the operational or programmatic things within Worcester DPH and the Alliance, but just, that this month is Black History Month, and a little bit about a training on that, a heart health month, different things like that. So it's a little bit more comprehensive. There's 2 versions of it. And this was sent out, like I said, in an email Matt sent this afternoon. So Nancy would have gotten. Karen, you may have been on it too. I'm not positive, but it came out late this afternoon. So this is our first pilot edition. And we were trying to capture kind of 2 different audiences, right? So one audience is all of you and the town managers, right? And the Board of Health admin staff, to get those updates on staff changes or upcoming internal meetings or things that surround more of the operations and the structure of the Alliance. But then we also wanted a more external version of the document that could be posted on a town website, right? Or on social media, that really is informative, not just for all of you, but for the residents in your communities or organizations in your communities, to have a better understanding of what the Alliance is, right? What services are out there in their town for public health and training opportunities and different things like that. So the email came out this afternoon. You'll see it talks about the 2 different versions, the one that's more external facing for residents, boards, commission members in your town, and then the secondary supplemental version, which is a little bit more specific and geared towards Alliance operations, that things that you would be interested in knowing, but a resident in your town would not be interested necessarily in knowing about. So please, once you have a chance to read it and look through it, please give us your feedback. Like I said, this is the first time we're doing it, but Matt's wonderful, and he's always looking for feedback. So please, feel free to email Matt directly. His information's in the newsletter and in the email, to contact him and give any suggestions that you have. So I'm actually going to pull it up just for the sake of any big updates to highlight for all of you. A couple staffing changes or upcoming staffing changes. Pat Bruckman, our chief public health nurse, is retiring, a much well-deserved retirement in March. So she's with us through Friday, March 11th. So we are sad to see her leave, but excited for her that she's going to be retiring. So she'll be retiring soon. Our business manager, Sue DiToronto, who you don't have much interaction with, but certainly she's very heavy behind the scenes on our end, helping to support us with operations within the office. She is also retiring in April. So we're very sad to see her leave. So we'll be looking to post those positions. We're also looking to post a public health nursing administrative assistant. So this is something that we've really identified that the nurses, especially with COVID, could use support on just the paperwork, right? And the data entry into MIIS, the supplies and all of the things that go on with the vaccine clinic, making sure that we have enough inventory. Do things need to be ordered? Did things not get returned that should have been returned? All those type of things. So we actually have some grant funding that we're going to put towards a position at least until the end of June. So at least through the end of this fiscal year, and then we'll kind of reassess where we're at with COVID and if there's still a need for that. But we're hoping that that will be helpful to have an additional person come on board to just support some of the clinical operations. Not really a clinical person, but to support the clinical operations behind the scenes. So we're excited about that. Our regional public health nurse, Jerry, who has been with us since September. She was doing work with Grafton Public Schools and working with the nurses in Grafton Public Schools. She was doing some of the blood pressure clinics. She unfortunately had to unexpectedly resign due to emergency family issues. So we are down a nurse, and we'll soon be down 2 nurses with Pat's departure. But we are working with HR to get those positions posted as soon as possible. So we should have more information on that soon to get those positions posted. In addition to that, I'm sure you've all seen some of the recent updates with the surge. We seem to be coming down on the other side. I'm sure you're seeing it in your case numbers, that case numbers are going down on a daily basis. Positivity rates are going down. In Worcester, the Worcester Board of Health is meeting tonight and talking about the mask mandate. The Millbury Board of Health, I believe, is meeting later this week to also talk about the mask mandate. And West Boylston has an upcoming meeting as well. I don't know if it's on their agenda. Shrewsbury is going to be talking about it at the 18th. So we'll certainly keep everybody posted just as different boards of health start to have these conversations, and any changes that may be voted on, in the coming weeks or so based on the data. So more to come on that, but we've seen that it is starting to pop up on the agendas, and not just in our alliance, but we're seeing it throughout the state. We're hearing about different communities also talking about that as well. A couple other things just to note real quick. Our community health improvement plan is now released in the newsletter. There's a link so that you're able to go on and view the newsletter. And as I think we've mentioned before, the annual meeting for the Coalition for Healthy Greater Worcester, which really is the accountability arm that really works to bring a lot of the strategies forward. That annual meeting is coming up in March. There's a link to register for that as well. I will also share our business plan is moving along. So we hired a consultant to be able to come and really work with us on developing a business plan for one, and really looking at our model, how we're structured, what the scopes of work are with the communities, the fees for the communities, what's the cost of doing business. So we're really excited that that work is moving. It's Zach Dyer, which some of you may remember. He was actually our deputy director years ago. So he's been working with Karen and I quite a bit, and has started to reach out to town managers. So in the coming weeks, he's going to be talking to all the town managers. So he'll have a conversation with Evan, and I believe if he hasn't already, he will be reaching out to all the Board of Health chairs as well. So Karen, I don't know if you've gotten an email. Okay.
I'm supposed to, as long as my work schedule permits. I'm penciled in right now. Hopefully it stays that way for next Thursday.
Perfect. Okay. All right. It was really important to us when we were talking to him about a business plan. It was really important to us that he spoke to, alliance folks, right? Key alliance individuals. And we were very intentional that it was without us, right? So we wanted it in a space that you could say anything about the alliance, good, bad, ugly, whatever you wanted to, and feel free to talk about that without, having peers or, Karen or I there, or anybody else from Worcester. So we're excited to really get that moving. Once he finishes up that business plan, then we'll move on to strategic planning. So he'll be reaching out to everybody again for strategic planning, as well as FAB reaccreditation. So we did get that extension. So we have until June to now apply for reaccreditation, and he'll help us through that process as well. So we're really excited to have him on board for that. I'm just gonna check real quick if there's anything else. There's another training that's in the newsletter coming up that I highly recommend. It's gotten great reviews. I know a lot of our staff have done it already or are signed up for it. It's the Worcester Trauma, Resiliency, and Racial Equity Training Institute. So they have a foundational training course coming up in March and April. So it looks like it's 4 sessions, 4 morning sessions coming up between March and April. The information to apply to register for that is also in the newsletter. I would highly recommend that training. We've heard great things about it. And I think I will stop there. Does anyone have any specific questions for me?
Not seeing any hands and no one's unmuting, so I'm going to vote no.
Sounds good to me.
All right. Well, thank you, Colleen.
Sure.
Perfect timing because we're on the dot for 6:45 for the public hearing. All right, so it's been a while since we've had to do, like years since we've done a public hearing, so I had to refresh my memory to make sure we were doing everything with the appropriate dotting of the i's and crossing of the t's. So thank you again for DJ and Sherry for joining us for this and helping us through this process. Before we get going, need a motion to open the public hearing.
This is Dan Finn. I'd like to make a motion to open the public meeting.
This is Austin Magnet. I will second that motion to open the public hearing.
And then roll call vote.
Dan Finn, aye.
Austin Magnet, aye.
Bill Muller, aye.
And Maynard, I.
Karen Gwiazdowski Govan, aye. All right, Austin, do you have the legal notice up and ready to roll to
I
read?
do. Yep.
Thank you.
So the Grafton Board of Health will be holding a public hearing on Monday, February 7th, 2022 at 6:45 p.m., which is now, via Zoom. Infos on remote participation for this meeting will be on the agenda that will be posted on February 3rd. To consider amendments of the tobacco regulations restricting the sale of tobacco products and nicotine delivery products. The proposed amendments are available by calling the office at 508-839-5335 extension 1119 or emailing health department or health DEPT, excuse me, at grafton-ma.gov. Excuse me. Sign the Board of Health. Karen Gwiazdowski-Govan, Chairman, Daniel J. Finn, Vice Chairman, Austin Magnet, Clerk, William J. Miller, MD, Member, Jennifer Maynard, Member.
Thank you, Austin. So just a couple housekeeping things. So just for anyone in the public who's not familiar with the purpose of this, the purpose of the public hearing is for the board members to review with DJ and Jerry the recommended updates to tobacco sales regulation that we have in town, and then to receive any public comment. That is part of the public hearing process, after all. Once the board has aligned during this meeting as to what updates we may want to include in the amendment for the regulation, then the plan is, like we've done in the past with this, we'll take that back, we'll get a final draft version with whatever updates that we want in it. And then most likely, I would assume at our next meeting, which is early March, we would take as a board a vote to adopt said regulations. I know that's what happened the last time. I had to go back. I think it was 2016 was the last time there was a public hearing related to tobacco regs. That's the process we did the last time. So I figured that's probably the smoothest way rather than trying to vote to adopt something that's not in a final draft form. For the public, if there's anyone who is in attendance on the Zoom or call, here's a quick brief on the process, given we aren't sitting in a room where it's a little bit easier when there's a public hearing. Any public comments will be addressed after any discussions by the board members. I will read any public comments or questions that may have been received in advance of the meeting, to which last I knew, unless something just came through, there was none. And then any comments or questions that someone in the public has, if you want to submit a question, the easiest way is to use the Q&A function that exists in Zoom to allow board members that are monitoring the Q&A function that you have a question. You can either submit that question through the Q&A function, which is the smoothest way to do it. Please include your full name and address as part of that. You can also alert the Board of Health members that you'd like to speak about a question or a comment. Same thing, use the Q&A function. That's the easiest way to do it. And once we're done with any discussions on our side, then we can go through and review any questions or comments that may have come through and then address those questions or comments, or if someone wants to speak and has told us, then we can obviously allow in Zoom the individual to speak. So that's it in terms of like protocol for how to approach any type of public comments, if there are any that anyone has. In terms of the recommended updates to the regulation, I don't know, DJ, do you think it's easiest if you give kind of the high level?
Sure, I can. Yes, I can give you the broad overview. Is that kind of what you're looking for?
Yeah, because I know I had asked all the board members to make sure that they pulled up the version that we had reviewed with the different color codings and to be prepared to go over anything where there was any type of decision to be made along the way.
Very good. So I'm looking at that too. I think it was from, I did up a draft for you on September 13th, and it probably has 3 colors, 3 bright colors. Is that the one? All right. And I also have the email that was between Sherry and Nancy Connors. So just introduce myself, just so you record. DJ Wilson, I'm the Tobacco Control Director at Mass Municipal Association. So just going through it, number 1 was updating the blunt wrap definition. And so we've updated the blunt wrap definition because we have a few companies that have tried to evade this by packaging their wraps just so it looks like a cigar, and so this is just to make it a little broader. And Cherry would be the one who sees these in the store. So if you have any questions as to what they look like, but a lot of times you can just be a sprinkling of tobacco in with a wrap, and they're calling it a cigar. Sometimes it's like several wraps loosely wrapped together. They're calling that a cigar. And so it was really hard to capture in a definition. So we broadened the definition for that. And I do have that with me. If people want to hear it, let me know. Number 2 is just a review on the rolling papers. For a long time, since the beginning of the state law that made rolling papers available to only adults, cities and towns were preempted from regulating them unless they had a pre-1989 regulation, I believe it was. And so very few people did have that. Very few towns did. And so we have a rolling paper definition. And so you can do really any broad amount with it now because you're unpreempted from working on it. So we do have, I think, one town that completely bans rolling papers. But I think the one that makes the most sense is to say that rolling papers, if they're flavored, we're going to treat them like enhancers. So one of the reasons that we're doing this, you might say to yourself, well, but they are enhancers. I don't know why you consider that to be a problem. The real problem is that the companies are more powerful and more likely to sue you. So we're trying to and we've gotten some heat from a hemp wrap company. Some towns north of the collaborative that's north of you, Tobacco Collaborative that's north of you, the Lowell Lawrence Collaborative has gotten some heat for trying to do something about hemp wraps. So it would be this definition that we've made up. And then in the state's tobacco product flavor enhancer definition, to add a sentence that just simply states a rolling paper with a characterizing flavor shall be considered a tobacco product flavor enhancer so that they get captured. So to the best of my knowledge, while a marijuana store retailer could not sell, can't sell tobacco, but I do believe they can sell rolling papers if they like. So even though marijuana is legalized, if those locations want to sell this product, that's fine. But our issue is that the same public health rationale as including the enhancers at all is that the state law was the legislature was clever, which they're rarely looking proactively at anything, but this time they did. They were very clever to say, well, I mean, if we ban grape cigars and they're selling a plain cigar with a little grape tube next to it, that defeats the purpose. And so I think I may have brought up that, in England, we've heard that there's a company that has made these cards that you put into a regular pack of Marlboros, for example, and an hour later the pack is mentholated. So that's the kind of thing that the legislature was trying to capture. But in this one instance, flavored rolling papers is still out there available. So it's using the same public health rationale as the whole flavor policy does. So number 3, I've talked is about the enhancer definition. Adding to E1, just using the word indoor. Oh, sorry about that.
Okay.
Your music, David. I'll talk over the music. E1, it's in the permit section. Just to add indoor, we had something happen in northern Berkshire County where a town did, this, you've seen it happen in different areas where downtown has to celebrate and to help the downtown merchants, let them roll product out into the sidewalk. And there was a cigar shop that did so too. So they were selling all their tobacco products out of on a folding table on the sidewalk. Ugh. So we were worried about kids being near that, whether or not they'd have good security about being able to do that. So if putting indoor means that smoke shop wouldn't be able to participate in that kind of thing, and that they'd actually have to invite people, adults into their store. G, in section G, cigar sales regulated. This is where the city of Boston, if you look down at G4, we have this very standard paragraph that says a Board of Health may alter those 2 minimum prices according to the National Consumer Price Index. We never really thought that anybody would think to do this, but lo and behold, the city of Boston did take the time and figure this out. And so they've raised their minimum prices to $2.90 for a single pack and $5.80 for a multiple pack. And so that's your choice. You can leave yours at $2.50 and $5 or raise it according to what Boston has found to be keeping up with inflation over the years. A big one is under H. And Sherry, this is again something that Sherry would probably come across and be able to tell you more about, is that if you go into a store and you go into their back, we've had it happen in the back room underneath the counter, and we found it in the ladies' room in one store, where there'll be a case of Marlboro menthols, and they'll say, "Oh, I'm not selling it. It's my personal consumption," which we know that's just not true. And so, this is a call. Obviously, if, the guy has a pack of open Marlboro menthols in his pocket, and that's the only one you can find, then that clearly would probably be his first personal use. So that's fine. But this really is going after people who are keeping in their back room prohibited flavor products, vape products, and selling it to the customers they know. And some of those customers may be underage. We still have never cracked the nut as to figure out what to do about in our compliance checks. These are kids that they don't know. In fact, they're oftentimes not from the same community. So they just don't sell to a kid they don't know, but they are happy to sell to the kids they do know. So that's one of the problems that we run into. So this adding possess, hold, and keep in the store requires them to have the prohibited product off premises. They can have it wherever they like off premises, or they can open another store and be a adult only retail tobacco store, or they can't even do that. They could be a smoking bar, so any availability to them. But so it's to clean the process up to make sure that doesn't happen. And lastly, way down on like second or third to last page, is this what looks like a complicated chart. And the chart really is it was complicated for us in the program to figure out what the new state law was covering and what it wasn't. And so this chart just makes it clear for retailers to be able to look at it and say, if you violate a policy on the left, it's a state policy and you'll get a higher fine. If you violate something on the right side, that's a uniquely local policy, and that's our own finding process, our own finding scheme and penalty scheme. So those are the 7. I don't know if anybody has any questions.
Dan?
Thanks, DJ. So they all look reasonable to me. I guess first, are our local other towns contiguous, I guess is the word, say Shrewsbury and Westboro, Millbury, have they adopted these yet?
This has been we've had a lot now, a 2-year lull in on policy updates because of COVID. But in your area, Shrewsbury has, with the exception, I can't remember, Cherry. I think Shrewsbury has done everything because they're pretty recent.
Yes, Shrewsbury did go into effect in November, and except for the minimum pricing, they have adopted all. The minimum pricing was not there yet when we were discussing the updates. This is a new addition to what I sent you.
Mhm. Thank you. And again, they all look fine to me. The one thing I'm wondering about is number 2. And I mentioned this at our last meeting about maybe banning only flavored versions of rolling papers. I don't know how everybody else thinks about that. I mentioned a particular case of a client of mine who uses rolling papers. And of course, I don't promote smoking, and I tried to talk him into quitting smoking, but he reminded me that he's 89 years old and he's a Korean War vet, and that he doesn't have that much fun, but he enjoys doing that. So I couldn't argue with him on that particular case. But I don't know how everyone else feels about they all look pretty reasonable and worthwhile to me.
I agree, Dan, with everything. Seems very reasonable, worthwhile. And except for the ban on the rolling papers, I'd like to keep it the enhanced ones only, and the natural flavored ones wouldn't have any sort of ban.
Jen, Bill?
I think that's fine. I think it's fine to leave it with the just the enhanced ones too.
I would agree.
Me too. All right. Looking through, I think that was really the biggest point that I know that was from the last time, and it looks like we lost DJ also. Yeah, I don't see him anymore. But I think that was really the only, not sticking point, the biggest point of discussion before we had the chance to really like review everything more in depth. Oh, here he's coming back now. He's
Sorry.
back. No, we were just going through.
I was just telling somebody yesterday, like, we have great Wi-Fi. Nothing ever stops, and then somebody else was in the house is watching a video. Sorry. So, yeah, no, I should keep my mouth shut, right? Yeah. So we're just relying on the same public health rationale over what the whole flavored policy was, that kids are easily addicted to tobacco and vape products because of flavors. And so, this is constant whack-a-mole. And, for those of us who are about my age, remember in the 70s and the 80s, Easy Wide wrapping papers came in one flavor, none. And so, but they figured out that, kids really love a lot of flavors. So, we're just trying to expand that to capture it. And it's really an expansion that goes on the enhancer definition that the enhancer policy that was already approved by the state legislature two plus years ago. We have the towns that have done something on rolling papers. It's all been on the flavored ones only. Are Shrewsbury, Chelsea, Somerville, and there's one other that I'm forgetting. And we have one town that has banned rolling papers altogether. So I should also say that at those 3 hearings, at none of those 3 hearings, all those boards of health held public hearings, and none of them had anybody come forward and testify about rolling papers. At the Shrewsbury hearing, which I attended, there was only one store there, and the store was there for to talk about something else. I don't know who showed up at the other hearings, but none of them addressed rolling papers as a concern.
All right. Any other questions or comments? So it sounds like the board members are in agreement with flavored rolling papers only. And then everything else that you went through, DJ, for the various updates and everything seemed fine. Austin, is there anything that's in the Q&A or anything?
No, nothing.
So I take that as no public comments, since we've seen nothing submitted. And all right. So like I mentioned, we won't vote tonight because it's easiest, obviously, to have a clean final draft of it that we vote on. So we'll plan on doing that probably, I would say, at the early March meeting. But seeing that there's no public comments or questions, then I guess we can close out the public hearing if no one on the board has any remaining comments or questions.
I can bring up.
Yep.
Go ahead.
This is, and I'd like to make a motion to close out the public hearing on the tobacco rigs.
Did DJ have something to say before we close it out real quick?
It's procedural, so you can go ahead if you want.
Okay, then I'll make a motion to close. I'll second that motion to close it. I mean,
Roll call vote.
Dan Finn, aye.
Austin Magnan, aye.
Bill Muller, aye.
Jen Maynard, aye.
Karen Gwiazdowski, Govan, aye. All right, public hearing is closed. Yes, DJ.
Procedurally, I can take these, I can amend these 7 into that very colorful regulation and get it back out to Jerry and Nancy and looking forward to you.
Perfect.
Thank you.
Thank you, and obviously both you, DJ, and Jerry, for this. I can just imagine it's not easy. I know my work involves regulations and analyzing them and reviewing them. Thankfully, I don't have to make them.
I mean, I will say, normally just as a broader thank you. Normally in the course of tobacco control, we've been, we update the sales reg and the secondhand smoke reg, maybe like every 6 months annually, small tweaks, nothing huge. But, we had 2 consecutive years of state law updates. And the second one was huge and, written in if you ever read a state law, geez, it makes no sense. We could never hand it out to a retailer and have them understand it. And so it's going through that and sifting through it and trying to figure out with Cherry and her counterparts around the state how it actually plays out when they're actually doing enforcement and talking to retailers has taken a while. And layered on top of all that, and then I'll stop talking, is that the tobacco industry is always trying to redo themselves to stay in business. So.
Agreed. All right. Well, thank you both again for joining the previous meeting and this meeting. We really appreciate it, and for all your continued work on this and coming forth when there are suggested updates and walking us through them. And the rationale also, we appreciate that too, not just saying, here's a document, have at it. We appreciate the background as to why certain things, are put in place and what others are doing too, because that helps us.
Very good. Well, thank you very much and have a good night.
You too.
Thank you.
All right, so that ends the public hearing and the public comment period. So on to COVID, the next topic, which is COVID-19 cases, vaccines, and mitigation efforts. So I'll start off with our typical case counts and any updates. As of February 7th, today, Grafton's been informed of a total of 3,009 confirmed positive COVID-19 cases since case tracking started back in early 2020. The number of new cases is coming down. Hopefully that trend continues to come down compared to what we saw in December, January. We're not down yet to what we were before the surge started to ramp up, but we're definitely in a better place than we were in December and January when Omicron first showed up, and then we had all the holidays in there. And as a reminder, we still have the mask mandate in town that was effective January 5th. Let's see. And from a vaccine perspective, we're continuing to strongly recommend that all individuals who are eligible to get vaccinated do please get vaccinated. And if you're eligible for a booster, then we strongly recommend you receive a booster as soon as possible. For the latest info on the vaccines and the boosters, eligible populations, how to find a vaccine location, we strongly recommend visiting both the CDC site to get a lot of information about the different vaccines, the scheduling for the time for spacing out with boosters, et cetera, because it does vary by which vaccine you get. And then if you're looking for locations, then the Massachusetts site does still have the vaccine locator, which will pull up if you put in like your zip code and what you're looking for, it'll pull up different locations. So it'll pull up the CVS's of the world, the Walgreens, and then also some the more local clinics that aren't done by, say, a corporation, for example. From mitigation, I should say, is there any questions before we jump out of the cases and vaccines? All right, seeing none. In terms of mitigation efforts, we've heard that Worcester is probably, as we speak, I think their meeting time coincides with the same time as us. Worcester is going to ask their Board of Health to vote to rescind their emergency mask mandate order. Obviously, we don't know what that decision will be at this point in time since it's happening right now. With the request going to that Board of Health that they rescind it with an effective date of February 18th. And I know that like Dr. Hirsch and City Manager Augustus, said obviously cases continue to be needing to look at, and around the fact of, as we all know, if horribly, and hopefully we never have another surge like that again, that there's the potential, obviously, and that's not just for Worcester, but any town or community who had a mask mandate that goes forth and rescinds it, there's always that potential that we could be in a situation where we have to turn around and be back sitting in front of a meeting again, talking about if the cases skyrocket like they did around the holidays, do we put a mask mandate back in place if ours was to get rescinded at some point in time by the board? So just something to keep in mind, that even if the board decides at some point to rescind the mask mandate, there's always that potential that cases could go in the wrong direction. In terms of the cases in the past couple weeks, like I said, they've been getting lower. So we were in like the 200s or so per week, unfortunately, around the holidays and parts of January. And then I know the week of January 21st to the 28th, we are at 102 cases, not good, but better than when we were in the 200 plus range. Last week, 129 to Feb 4, we were at 47 cases. So hopefully that trend continues, but who knows? Fingers crossed that subvariant of Omicron doesn't cause any further surging or another variant that we don't know about yet. So I wanted to, bring it up to the board, obviously, similar to when we were first discussing, do we put a mask mandate in place when we saw the cases starting to surge up? I wanted to bring forth to the board as a discussion topic, similar to what Worcester's doing, and we've heard other towns will be doing in the near future. Do we want to talk about when, if and when we want to potentially rescind the mask mandate that we'd put in place back in early January? Dan?
Yeah, I'd like to see how everyone else feels on the board, but it seems to me we should align ourselves with Worcester in this particular case, maybe with the same dates, or think about that. I don't know that we have to wait until after tonight's Worcester meeting. Things have certainly gotten better. And there would be, I don't have a calendar in front of me, but that almost 2 weeks to monitor it, to make sure if we do vote to rescind, that the trend doesn't go back up. I don't know what other folks think.
Who was it again that's asking Worcester to rescind the mask mandate by the 18th?
Dr. Hirsch
Yeah.
and Augusta.
Augusta. Yeah.
Okay.
Yeah, I am aligned with what Dan had suggested. I think if Worcester is going to go in that direction, I think it's appropriate at this point in time. We've aligned ourselves with what's come out of there. And I do think that the numbers from last week are very promising. Hopefully we'll see just as low, if not lower, this coming week.
Dan, Bill?
And that's, if we decide to do that, I'm sorry.
No, I think I saw your hand go up first, Dan.
If we decide to do this, it's obviously we still want to strongly urge people to continue wearing masks, certainly in populated areas or supermarkets or whatever, and keep a strong recommendation and get that out there as our policy. But
Bill?
Yeah, I think our monitoring suggests there hasn't been total compliance with the mandate. I do think that we should strongly recommend that people continue to use masks. But I do think doing away with the mandate to some degree takes a little pressure off of the merchants in terms of enforcement. In terms of trying to compel people who are non-compliant to wear a mask. I know we have some data from the monitors about what the compliance has been in various sites. I do think our signage has not been what I had hoped it to be. I think in Shrewsbury, for example, they have better signage and so forth in terms of the, really the mandate requiring it. But surely it's very encouraging that the rates are down. Now, admittedly, since many people are now doing home testing, those rates may be a little bit deceiving in terms of exactly what the incidence is. But if you use things like the surge testing in Boston and other places that can do it on a very large scale, I think Omicron, is definitely in a declining mode right now. So I think it would be reasonable to say that we strongly recommend it, but we're going to remove the mandate.
Austin?
Yeah, I agree with everything Bill said. It was very well said. And plus, it will help remove a lot of the stressors on the merchants, like he was saying, that still try to enforce it with people who are non-compliant.
Yeah, I think the only thing I would add to not going anywhere, it's going to be here. So I think, folks just have to, pay attention to what's happening with themselves. And again, do what they can to mitigate
transmission to other folks,
Right.
not going anywhere. So we're going to see more and more, I'm sure, as times come.
Dan?
And if, and I think personally, obviously, the schools should continue with the DESI guidance till the end of the month. And municipal, it's a different, slightly different topic, but the municipal center and the idea of remote meetings should be up to the chair people of the committees and the municipal center, town administrator in that regard. But if it's okay, I think I would like to make a motion that we officially rescind the so-called mask mandate that went into effect on December 5th, I believe.
January.
January 5th, thank you. And with a target start date of that rescinding or whatever, rescind of February 18th.
There a second?
I'll second that motion to rescind the mask mandate by February 18th, which is next Friday, it looks like.
Yep.
Right.
And still strongly recommend that people wear masks.
Follow the DESI guidelines for everything else.
Right. Roll call. I have a motion and a second.
Dan Finn, aye.
Austin Magnet, aye.
Bill Muller, aye.
And Maynard, aye.
Karen Gwiazdowski Govan, aye. So motion passed.
Karen, we do have something from the school committee about what the posture should be regarding the schools. There's a inquiry on chat here.
Comment.
Yeah, it's on the chat. Can't scroll.
Yeah, Amy Marr, School Committee Chairperson, 36 Ferry Street. Today, Governor Baker announced that the Department of Elementary DESI will be announcing a change to their mask mandate, which currently goes through February 28th. It seems that the Board of Health may need to meet again during the month of February to reevaluate the situation.
She answered all set in the Q&A.
Okay.
Mhm.
All right. All righty, perfect. Thank you. And I've been so busy work, I hadn't even heard that there was any announcement yet, so glad to hear that. All right, so we have that. We can get that written up, put out with the plan, like we said, for effective rescinding date, if that's the appropriate term, of February 18th. And then we'll just continue to keep an eye on the data and hopefully it all goes in the correct direction. But like Jen was saying, same thing, like I was going to say it's going to be here, it being COVID, it's going to be here for the long haul. So we could definitely see potential, surges. They may not be humongous surges like we saw with Omicron around the holidays, but we could definitely see some ups and downs along the way, unfortunately. So, all right.
As far as the schools, Karen, if in fact the governor does announce a change in state policy, would we be willing to meet to reconsider the school policy?
We don't have a separate school policy. We hadn't put a separate mandate in place for the schools.
Right. So the state changes its policy, then they would be free to adopt that change.
Mm-hmm. Yeah, we hadn't forced anything extra
Right.
on the schools because they were already, we didn't go above and beyond DESI, I should say. So we don't have to
You
pull
did
anything.
not act independently.
Yes. If we had put something in place, then yes, we would have had to potentially, if the state did something, then we would have had to meet again, depending on what the
Right,
state
okay.
is doing.
Okay.
All right. Is there anything else? That was what I had for mitigation efforts. That was the pressing topic, was the mask mandate. All right. All right, so there's nothing else on COVID, then the last topic we have on the agenda is Village Dairy. There was a tobacco violation that we were notified of. So I have it that Sherry had notified us on December 29th that out of the inspections done in town for tobacco, the Village Dairy was the only establishment that was found not to be in compliance with the tobacco sales regulations that still are in effect at this point, not the ones we just discussed for updates this evening, or potential updates, I should say. And their non-compliance that was found in December was related to the cigar pricing regulation. They were found to be selling a pack of 2 cigars for $2.50, but per the regulation, a 2-pack needs to be at a minimum of $5. Single cigars are at $2.50 or more, but this was a 2-pack. Since it's been a while and some board members may not have even had previous history with reviewing tobacco regulation violations. This is a local. It'll be much clearer when we get to the nice new chart that gets added in the latest updates, but the cigar sales regulation piece is a local regulation, not a state regulation. So the violations would fall under the local regulation fine section. Looking at the history for Village Dairy in any violations, their last violation was on December 13th of 2018, so a little over 3 years ago. So the way the violation wording works in the regulation for local parts of the regulation is, in the case of a first violation, it's a fine of $300. In the case of a second violation within 36 months of the date of the current violation, it's a fine of $300, and the sales permit for tobacco products are suspended for 7 consecutive business days. In this instance, based on the reading of the regulation, because it's just over 36 months since their last violation, it would fall under a first violation again, because that 36-month by the day clock got reset back as of December 13th of 2021. So the question for the board is, and how we've typically handled these in the past for at least Jen and Bill, and I don't remember if Austin and Dan, you've had any experience in this before. You lose track of who was around for what topics. We don't have many tobacco violations. That's why I'm trying to think of the last time we had one, which is a good thing, that we don't have many. Typically, we've offered up to the owners of said establishment if they would like to come in front of the board for a public hearing to discuss the violation, and as to whether they'll get any sort of penalty depending on what their violation was, obviously, if it was a state violation versus a local violation.
Are these the same owners as last time?
That I don't know.
Good question.
Does that make a difference? I would think, on, you know, even that offer, even though they're outside of the window.
Let's see, how's Nancy? Nancy is having issues, but she just sent me a message that yes, it is the same owners. Nope, Jerry.
This same owner also has a store in Worcester. So And in Worcester also, we have the same regulations, and they are in compliance in Worcester. So they probably know about this, I would say.
Dan, I think you were
Yeah, I
next.
just want to mention, I think there's actually been a long history of probably 7 or 8 or 10 years. I don't know if it's been the same one as for that long, but, and I guess Sherry and Karen, we have to lean on your experience. Is it the town that would issue a $300 fine, or the Alliance, or how does that, and they might be out of that window anyway, but.
I'd have to honestly go back because I honestly don't remember when our last tobacco violation was, like who actually physically gave them the fine.
Yeah.
But it's on us as a board to have them in to discuss. No different than if
Yeah.
we wanted, if there was a concern with a food establishment, it would be on us. Now we have, whether it be Sherry, Colleen from the Alliance, et cetera. I think typically like the physical ticketing fine, whatever you want to call it,
Right.
often comes from like the Alliance. But if they're coming before us, it would literally be coming before us, the board, because there are regulations. They're not the Alliance's regulations.
Karen, it does sound like strict compliance with the period between these two violations would require us really to have them come before us rather than to find them at this point. I'm not sure that since it's over a 3-year period, that in fact we have the authority to find them at this point, but we could certainly.
Well,
make
we
it
do
clear
have the
to them.
authority to find them because the regulation states that your first violation is a $300 fine.
Oh, okay, yeah,
Yeah,
I misunderstood, I'm sorry.
the question would be as to your point, Bill, if we wanted to do anything more drastic, like the 7-day and a fine.
Right,
But
correct.
I think they are lucky that they're outside of the window because they seem to know the rules.
They're lucky. Well, I think we should invite them to our meeting. I mean, we can certainly find them.
Yeah, I mean, there's nothing in the regulation that states we have to have the public hearing.
Right,
It's more good partnership, reminding,
right,
discussing. We've done this, in the past. We've done it with certain food permit holders, that it's kind of the conversation along with there's going to be a fine, but it's the discussion to stress the point of you're getting a fine, don't let it happen again, because if it does, then you are, and it's rare, if I can't think of how
Yes.
far back it's been, but it's rare, but we have gone down the path of having to pull the permit for 7 business days, to which of course everyone freaks out, but it's like, well,
right.
that's what's very explicit in the regulation.
I seem to recall that happening to some alcohol businesses, right, where they.
Yeah, I
And
mean,
the
it's
holiday.
outside of our world for alcohol, but I know it's happened with alcohol places.
Sure.
But it's happened with tobacco during my time on being on the
How,
board.
how often are we inspecting them?
Sherry?
So I did inspections this year twice. One was the retail education, and then this was the enforcement. And then we usually do compliance checks also, but due to COVID-19, we did not do, but soon, like we will begin sometime this year.
All right, so yeah, we'll invite them. Doesn't
Yeah.
hurt to, invite them to discuss.
Do we
And-
need to make a decision about, sorry,
Fine.
is it an inviting with a fine and that, we're coming to have a conversation? I just wondering.
Depends on how the board wants to handle it.
Well, you could consider it a first violation because of the periodicity of it and say we've waived the fine in lieu of having a conversation with them.
Right.
But if we don't find, then technically, are we in violation of our own regulation? Penalties.
I'm not an attorney.
I don't think there's anything in the regulation that says we.
It's still a violation.
Yeah,
and we
I don't
just-
think there's anything in the regulation that says we have explicit power not to assess a fine if there's a violation. I'm also not an attorney.
Let's say it was your idea, though.
If you choose not to find them, so what other towns have done is they send a warning letter to the retailer and letting them know this is a final warning, and then if this the regulation is violated next time, then they will be fined.
Dan?
Yeah, I agree with that, but also make it contingent on them actually coming in to speak with us and coming up with an action plan or an explanation as to why this happens, to make sure that the proprietor as well as the other employees are well aware of the regulations. And I think if they don't come in with the warning letter, then we should fine them. But communication is important. I think we should give them a chance to come in and explain what they're going to do to prevent it in the future.
I can agree with that.
I tend to think they already had that opportunity 3 years ago and they're just getting lucky that they're outside of the window. Unless they have like drastically different staff members right now. Again, same owner, and
And the
they have
pricing-
other,
The pricing
Yeah.
would be determined by the owner, not by the salesperson.
right.
So how do we want to handle it, since we're kind of like,
And it's still,
half and half?
You a split decision, Karen? Are you leaning one way or the other?
I'm leaning based on the history that goes beyond
Mm.
3 years and a couple
To find-
weeks
To find them.
to find them.
I suppose that's cleaner because it's same owner, right? So it's not like it's news to them.
And they are in compliance in Worcester. So
Right. And she was out another time earlier this year as well. So, or the new year, but recently. So, I mean, I struggle with it always being education, especially if there's the history, as you said.
I'm okay with that.
yep, me too. I think we're in agreement
yeah,
after considerable discussion.
Right, so is there a motion? Just cleaner to do it with a motion and a vote, I'd say.
This is Bill Muller. I'll move that we find them as a first offense per our bylaws.
This is Dan Finn. I'll second that.
Roll call vote.
Dan Finn, aye.
Austin Magnet, aye.
Bill Muller, aye.
And Maynard, I.
Karen Gwiazdowski, Govan, aye. All right. Thank you, everyone, for that. So that was it that we had for topics on the agenda. Under old/new business, I just wanted to remind the board members that I need to get your completed conflict of interest
Oh,
documentation by February 15th via email. So that way I have time to put it together. So we're all in compliance with the town clerk in advance of their deadline. So just a subtle reminder, shall we say.
Thank you.
That's all I had. I figured I would take that opportunity under all new business. And then that was it that I had.
Sick?
That's it, yeah. A couple heavier topics today. Let's see. There was no mail or correspondence, so that leaves upcoming meetings March 7th, April 4th, May 2nd, and June 6th, all of 2022. So if there's nothing else, then is there a motion to close the meeting?
Yep, this is Dan Finn. I'll make a motion to close the meeting.
This is Austin Magnan. I will second the motion to close the meeting.
All right, roll call vote.
Dan and I.
Austin Magnan, aye.
Bill Muller, aye.
And Maynard, I.
Karen Gwiazdowski, Dovin, aye. All right, everyone, have a good evening.